I'm going to talk about strep throat. Hi everyone, thank you for tuning in. Again, my general rule is always seek medical professionals for proper management of your sore throat, and what I'm going to discuss is basic information about it. Strep throat is a group A streptococcus, also known as Streptococcus pyogenes, is the most common cause of bacterial pharyngitis in children and adolescents who are between 5 to 15 years old. It is a gram-positive coccus that grows in chains. What are the signs that you look for? Abrupt onset, fever, headache, abdominal pain, nausea, and vomiting may accompany the sore throat, leading to poor intake. Other additional features may include exudative tonsillopharyngitis with enlarged erythematous tonsils, enlarged tender anterior cervical lymph nodes, palatal petechiae, inflamed uvula, and scarlatiniform rash, which are the erythematous, finely like papular rash, which starts in the groin and the axilla and then spreads to the trunk and extremities, followed by desquamation. So some of the viral features like runny nose, conjunctivitis, cough, hoarseness, anterior stomatitis, discrete like ulcerative lesions or vesicles, diarrhea are usually absent. So the symptoms usually resolve spontaneously in 3 to 5 days. If the strep throat is not treated, although some cases of group A strep pharyngitis resolve without complications, it can lead to serious non-suppurative and suppurative complications. Some of the non-suppurative complications of strep throat are acute rheumatic fever, post-strep reactive arthritis, acute glomerulonephritis, pediatric autoimmune neuropsychiatric disorder associated with group A strep called PANDAS. Suppurative complications of group A strep pharyngitis include necrotizing fasciitis, bacteremia, peritonsillar cellulitis or abscess, otitis media, and sinusitis. How do you diagnose strep throat? By doing a rapid detection strep throat swab in our throat culture. Molecular assays as well is used, such as PCR. So what are your differential diagnoses? You can consider other bacterial infections and viral infections, so taking a good history is very important. The treatment for strep throat includes penicillin-containing antibiotic. It has been studied and shown to reduce the rates of acute rheumatic fever if it's taken for 10 days. Treating for 10 days appears to enhance the full eradication of group A strep compared to the 5 or 7 day period. For most children, we either use the oral penicillin V or amoxicillin. Amoxicillin is often preferred for young children because the taste of the amoxicillin suspension is tasty than that of the penicillin, and it can be given once daily. Cephalosporins, clindamycin, macrolides are also alternatives for patients who are allergic to penicillin or who can't otherwise tolerate penicillin. So what to tell parents about strep throat? Number one is you look for signs of severe throat pain, fever, temperature that is higher than 100.4, 38 degrees Celsius, swollen glands in the neck. Your child is not getting enough to eat or drink. Your child develops a red rash or peeling skin. Your child develops joint pain within a month of having strep throat. Your child's urine becomes red or brown. Your child still has symptoms after finishing antibiotics. And apparently also advise them to change the toothbrush as well. Things to do at home for the parents. So number one, soothing foods and drinks. Give your child things that are easy to swallow, like tea or soup, or popsicles to suck on. Your child might not feel like eating or drinking, but it's important that they get enough fluids. Number 2 is medicine like acetaminophen or ibuprofen can help with throat pain. The right dose depends on your child's weight. Don't give aspirin or medicine that contain aspirin. So don't give aspirin or medicine with aspirin to children younger than 18 years old. In children, aspirin can cause a serious problem called Rye syndrome. And so don't give children throat sprays or cough drops either. Throat sprays and cough drops contain medicine, but they are no better at relieving throat pain than hard candy. Plus, throat sprays can cause allergic reaction. Add also moisture to the air. You can use a cool mist humidifier to keep the air from getting too dry. And if you don't have a humidifier, you can sit with your child in a closed bathroom with a warm shower running a few times a day. So also avoid smoke. Don't smoke around your child or let others smoke near them. Being around smoke can irritate the throat, plus it's dangerous to the child's health. Other treatments for children who are older than 4 to 5 years, sucking on hard candies or a lollipop might help. For children older than 6 to 8, gargling with salt water might help. So again, hope this helps. See you next time and consult with your expert professionals as always. I'll see you guys again in the next vlog.